Should you take magnesium to help you sleep at night? That's a question I've recently been wondering about because I've seen more and more people take magnesium for sleep. Not only that, I've heard of some of my doctor colleagues recommending magnesium for sleep. So really, what's the deal? Should you be taking magnesium to help you sleep? Well, I'm going to give you the answer today, guys. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Let me give you a little information about magnesium because this is really, really important before we get into whether or not you should take it and if it works. First of all, magnesium is a mineral that we have in our body, and for good reason. It does so much in our body. It literally affects everything. So it's important that we get a certain amount daily. The amount that we should be getting daily is about 300 milligrams a day per woman, about 400 milligrams per day for men. And again, this is a recommended daily amount that we should just be getting anyway. This is the thing. If you have certain medical conditions and things like that, of course, you might need more or less or what have you. It's up to your doctor to determine, and it depends on your medical conditions, but that's a baseline. Now, this is the thing. In addition to getting magnesium from supplements, which is what some people, I believe, are doing to try to help them sleep, which again, we're going to talk about in a moment, so don't go anywhere. We can get magnesium from foods. Foods that have magnesium include things like green leafy vegetables, nuts, seeds, grains, and things like that. And there is the possibility of not having enough magnesium. That can cause nausea, vomiting, fatigue, weakness, etc. And in fact, if you ever had questions about your magnesium levels, you could ask your doctor for a test. Now, I'm not advocating that you do this. We don't check for things unless there's a reason to, but my point being is that magnesium levels in general can be checked. So these doctors can help you with that. So, that's a little bit of information about magnesium. It's a very important mineral. And of course, we know the importance of having magnesium in our bodies just regularly and getting that recommended daily amount. And of course, we know the importance of sleep because, hello, insomnia is not good for anyone. But then the question comes back to what I said in the beginning, which is, well, does magnesium help you sleep better? Will magnesium help insomnia symptoms? What is the deal with that? Well, there are some scientific studies that suggest that magnesium in some people actually helps them sleep better and helps with symptoms of insomnia. But just like there are studies that show that it helps in some, there are also studies that say it doesn't make a difference at all. In other words, the studies are a little bit mixed. It's not a slam dunk. And I think that's really important to keep in mind here. The data is evolving, it's growing, so we're getting more and more information every day. But when it comes to what people are doing, are some people choosing to try magnesium to see if it helps their insomnia? Absolutely. Are some people finding it beneficial? Sure. And have I talked to some doctors who say, yeah, it's something you could try? But does it mean that it's standard of care? No, because giving magnesium for insomnia is not standard of care at this time. So you're saying, well, Dr. Jen, then what does this mean? So what am I supposed to do? What are you telling me? What are you saying? Well, what I'm saying is, just like so many things in life, look, it might help some, it may not help others. There's still more information we need to know. If this is something you are interested in trying, what you need to do is you got to talk to your doctor. Because you got to remember that while taking magnesium, extra magnesium might not be a big deal for some, it actually might be a huge deal for some other people, depending on their underlying medical conditions and other medical concerns they might have. So you don't want to start anything without talking to your doctor first. And remember, there are lots of potential causes of insomnia, and sometimes we have to rule out other things, whether it's, well, I'm not going to get into that because this video is not about that, but there's lots of potential causes of insomnia and other treatments as well that do have more evidence behind them. But once again, if you're interested in trying magnesium, talk to your doctor. See if this is something that might be right for you, and also get your doctor's advice about how to proceed if that's the case, understanding that, it may or may not be right for you. Either way, guys, I hope this is helpful. I'll keep you updated as, information and evidence evolves. We'll see what sort of comes out in the wash, but I think it's suffice to say that some people use it, some people don't, some people recommend it, some people say it doesn't work. The data is evolving, so that's where we're at. Make sure you talk to your doctor. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and video creator. I hope this was helpful. I do videos like this and all sorts of other videos every single day. If you have not subscribed to my channel and click the little bell for updates, I invite you to do so. Guys, I'll be back soon.